Hello, everyone. My name is Jennifer Bacani McKenney, and I am a family physician in Fredonia, Kansas. And I am going to talk to you today about what I do and why all the cool kids practice medicine in rural areas. All right, let's go and see what we can find out. So I want to start off by telling you a little bit about how I got here. I was actually born in Fredonia, so I live in my hometown. I went to the University of Kansas, where I did my undergraduate studies. I got a degree in chemistry. I always tell people that it doesn't really matter what you get a degree in, but as long as you enjoy what you do, what you're getting a degree in, it will translate into useful information for later on. Now, if you aren't getting a science degree, you might have to take extra classes. But otherwise, if you want to major in business or you want to major in Spanish or something else, go for it. Do something you love, but then also make sure that you're doing the science classes that you need to do to become a successful doctor. So after the University of Kansas, I went to KU Med, and I spent my first 2 years in Kansas City, where I did all my clinical rotations. Where I did all my classes for learning all the science behind becoming a doctor. And then I went to KU in Wichita, where I did my clinical rotations. Then I did my residency at Via Christi. And so residency for family medicine is 3 years. And you learn everything you need to know that you didn't learn in medical school. So you learn all the basics, the science, and everything in medical school. And then in residency, you're actually a doctor, and you get paid, which is very exciting. And then you practice as a doctor, but you also have doctors that oversee what you do so that you don't mess things up too bad. And so after my 3 years of residency, and just to review, 4 years at the University of Kansas, 2 years at KU in Kansas City, 2 years in Wichita, 3 years in Wichita for residency. And then I returned to Fredonia, my hometown, where I've been practicing for the last 11 years. And this is a little thing I like to call the circle of life. That is our resident monkey holding up all the baby lions that are born in Fredonia. Just kidding. There's only a few baby lions born in Fredonia. Okay, moving on. This is me and my dad. So my dad actually has been here for 42 years. He's a general surgeon, but he also does general practice. So in addition to doing surgery, he also takes care of people's high blood pressure, diabetes, things like that, like what I do as a family physician. This is our cute little picture. When I was little, I'm the one without the mustache, just in case you weren't sure. And this is us now. I'm still the one without the mustache, although as I get older, that's a tougher challenge. But we're still adorable. Look at us go. How did I end up in Fredonia? Well, my parents are from the Philippines, so they took a direct flight to Fredonia International Airport, and here we are. Something like that, but if you want more information, I'm happy to share that at a later time. Where is Fredonia, you might ask? Well, Fredonia is located in southeast Kansas. If you know where Wichita is, it's about an hour and a half away from there. It's about 2 hours from Kansas City, about an hour and 45 minutes from Joplin, 2 hours from Tulsa, 9 hours from Denver. And if you really were feeling feisty, you could get to Mexico City in a day and a half if you drove straight through. Not a common trip, but it's something that we can do. Just to tell you a little bit about Fredonia, it is a nice little town of 2,500 people in southeast Kansas. We have a homecoming festival. We have a large mound, which is kind of rare in southeast Kansas because most of it's flat. We have a great community where I grew up, where I know everybody, where they know me, where they know my kids. If my kids or my pets run off, they'll usually end up in the right place again. So to tell you a little bit about what my day looks like in Fredonia. Probably everybody watching this is too young to know what Days of Our Lives is, but it was a soap opera that was on for about 9,000 years, and people died and then came back to life. But this is what my day looks like each day. So I see patients in the hospital. So these are going to be our sickest patients, like with pneumonia, or if they've had a stroke or a heart attack or something like that. I also do procedures such as endoscopy, meaning colonoscopies. That's looking for colon cancer in somebody's colon, lesion removals where we might take off skin cancers, things like that. We do stress tests. We do basically anything, laceration repairs, anything that our patients need us to do. Then we also do surgeries. Like I said, my dad is a general surgeon, so we might take out gallbladders, fix hernias, do mastectomies for breast cancer. So I assist him in those surgeries. I also work in the clinic, and so that's kind of what you might hear about day to day, where a patient comes into my exam room, we check their vital signs, we talk about everything that might be bothering them, and physically, mentally, everything. And then we see about 20 to 25 patients every day in the clinic as well. And we'll talk a little bit more about that in a second. I also help run the emergency department. We doctors in Fredonia each take turns taking care of whatever comes into the ER. So that might be somebody with a toothache. It might be somebody with a heart attack. It might be a 5-car pileup on the highway. We're kind of the only gig in town. And so if we have somebody who needs attention, then we're the doctor that helps. Now that sometimes means that we ship people out of the ER, but we try to take care of everything to make sure they're stable before we ship them to Wichita or Kansas City or one of those other places. We also run the medical staff, so we make the decisions on policies and things in the hospital, how things are done, and we are the members of the different committees, such as making sure that patients are safe and that all of their issues are addressed. So an example of the procedures that we do, so a colonoscopy is how we check for colon cancer. And if you don't know where that scope goes, maybe Google this later on. But I have had the opportunity to fulfill every young girl's dream of performing her mom's colonoscopy alongside her dad. And so I've not done this once, but twice actually. You'll be happy to know that my mom is just fine. The first time she said she wanted to help me practice doing colonoscopies, which is weird, but a great mom kind of sacrifice. The second time she was actually having issues. And so we were able to do that. And, it's kind of a weird, cool thing. A story about, us in the emergency department. I had a kid come in and his parents brought him in and they said, well, we were out at the lake and I think my son got his toe bit by a copperhead. And I was like, well, are you sure it's a copperhead? And he picks up a bag and he says, yes, it's right here and it's still alive. I'm like, why did you bring in a live copperhead? I would have believed you if it was dead also. So anyways, this is some of the stuff that we deal with. And copperhead bites are very dangerous and can be life-threatening. But at that moment, you have to figure out, number one, how to kill a copperhead. And number two, how that child needs to be treated. Can they stay in my hospital? Do they need to be transferred out? Do we have the supplies to be able to take care of this kid who just got bit by a copperhead, like the antivenom, and is it appropriate to give it to him? So again, you just have to figure out what to do, and you just never know what you're going to encounter each day. So I practice family medicine, and what that means is that we work a lot with preventative medicine, meaning doing mammograms and colonoscopies and things like that to prevent cancer or catch it early where we can. We talk about wellness a lot, keeping people from smoking or helping them quit smoking, making sure that they're exercising and eating well so that their diseases never happen in the first place. We also do women's health. So we do pap smears to screen for cervical cancer. We talk about contraception and provide that. We talk about how women can stay physically and mentally healthy also. That's a speculum that we use for pap smears. We do men's health also. So we talk about testosterone levels and erectile dysfunction, things like that. We do prostate exams also. We do pediatrics. So we do well child visits. We talk about developmental issues with children. We run the nursing homes as well, as in we go and round on people at the nursing home up until their end of life. And speaking of end of life, we also do hospice. I'm also the hospice director, and that is when a person is at the end of life and we want to make sure that they're comfortable. We do mental health as well. So even though I'm not a psychiatrist or a psychologist, we do a lot of mental health, especially in these times when people are very anxious or they're feeling depressed. We may be their first line. We may be their only person that they trust, or the only person they know to go to about their mental health issues. We deal with diabetes, high blood pressure, cancer. In rural areas, people can't just run off to see the cancer doctor all the time because they are 90 miles away. They can't go see the endocrinologist every day because they aren't scheduling appointments for 3 months. So they need me to help manage their diabetes and their blood pressure and cancer issues. Like if they're throwing up because of their chemotherapy, I'm there to help give them IV fluids and give them nausea medicine to help with that. And we do acute care. So if somebody breaks a bone or cuts themselves, we take care of that also. Again, whatever walks in the door is kind of our job. So I was going to tell you a little bit about my practice and what like the financial parts about what a medical practice looks like. So that's Han Solo, just in case, again, you don't know who that guy is. So I'm in solo practice or a private practice, meaning that I'm not employed by anybody else. In fact, I employ my dad at this point and other partners, and then I employ all of our employees. So you might have another option of going into a group practice where you're all partners, or you might be employed by somebody like a large hospital or group. And it just depends on what your interest is. And I'll tell you the kind of the pros and cons of each of these. In a private practice, I'm the business owner, so I get to set the prices, I get to set my hours, I get to set the rules, I get to employ people that I think would be a good fit for our team, rather than having somebody else do something like that for me. I get to make my own schedule. So if I don't want to work on a Friday, I don't want to work on a Friday, and I don't. If I want to do something like speak to students, I'll do that, and maybe not see patients that day. So I have lots of flexibility with what I want my life to look like. And my work determines my pay. So if I want to work 7 days a week and 12 hours a day, I'm going to make a lot of money. If I want to work 3 days a week or see patients 3 days a week, which is what I do now, I still make a decent amount of money. And so, but you just may not make as much as if you're working more hours. And that's okay. It's all about quality of life, I believe, when we're talking about our practices. And in general, a family physician usually makes anywhere from maybe 200 up to maybe even 400,000 or 500,000 in a year, depending on your practice. And so there's a big range. In rural areas, we actually tend to do pretty well compared to our urban partners, because again, there's no lack of business. We do kind of a little bit of everything, and sometimes those procedures will pay more than maybe a 15-minute office visit for a cold. And so you can do all the things that you want to do and get paid well for them. And then you set the culture of your clinic. And so if you want a fun clinic, where people are laughing and joking all day and wearing costumes at certain times, I have a picture of that too, then you'll do that. But if you want something very serious and quiet and somber and peaceful, that's okay too. It just depends on how you want your day-to-day to look. So cons might be that you are a business owner. So I didn't take any business classes when I was in school. And so you kind of have to figure that stuff out along the way. And it's okay, it's doable. As doctors, we are constantly problem solving and having to learn, and this is what we do. But if you don't feel like owning a business, then this might not be for you. You have to learn about business, like we talked about. You pay overhead costs. So you don't have the hospital who, if you have an exam table that breaks down, you have to go out and buy one, and they're not very cheap. And you have to figure out how to pay your employees, how to make sure that they all have insurance, and that you yourself are paying taxes correctly, things like that. And your work determines your pay. So if I'm not seeing patients, I'm not getting paid. So again, it can be a pro and a con to be your own business owner and own your own practice. So this is my clinic. This is an example where we like to dress up for Halloween, and we sometimes do fake toast out of urine specimen cups, just because it seems like the right thing to do. But we have a lot of fun in our clinic. I actually work also in conjunction with, not for, but I work in conjunction with our hospital, Fredonia Regional Hospital. That's a 25-bed critical access hospital. And what that means is it's a special designation by Medicare, or the big federal insurance that that is how our people age 65 and above are insured. So Medicare says, hey, yeah, you get to be a critical access hospital, but you can only have 25 beds or less. You have to be in a rural area. You have to have emergency services 24 hours a day, 7 days a week. And most of your patients should only stay about 4 days or less. And so if I have a really, really, really sick patient, I probably had better transfer them out to a bigger hospital, which is what that means. And so, so most of our patients that we keep in the hospital maybe have, like I said, pneumonia or a bad urinary tract infection, or they're there for rehab, those kind of things. This is what it looks like. I'm pretty proud of our hospital. So in small towns, we still have really beautiful hospitals. In this case, you can see that each of our rooms are private rooms, and our staff is amazing. And I just think we do a really good job. So never underestimate the resources that you can find in a smaller hospital. We have 5 physicians and 3 nurse practitioners. And we have all of these things that you would want in a bigger hospital, except we might just have a smaller version of it. So we have 1 physical therapist versus many. We have 3 respiratory therapists. We have 1 MRI machine, but we can't use it in the evenings. We have to only use it during the day. We have a CT scan that we can use all the time. We have surgery, but we only do surgery once a week. And so again, we have all the capabilities to do these things, but we can't necessarily do them all the time, or we don't have them to quite the larger scale, but we have great resources. This is, again, my dad and I, we do surgery together, like I mentioned. And so it is nice to be able to do that for our patients rather than them having to drive an hour and a half to have a hernia surgery and then have to drive home after they're in pain. They can do that right here in Fredonia. One great example, I think a good story of us doing surgery is that my dad had a patient that was having abdominal pain. And we had no idea. He had done all these lab tests. He had, asked her so many questions, trying to figure out what it was. And it was just this bad pain. So we did a CAT scan of her belly, and the radiologist called, and I happened to talk to him because my dad was gone. And he said, well, I really think there's something in there. So we took her to surgery, and we did what we call running the bowel. And what that means is we start at the one end of the colon, and we go all the way around and feel around until we find something. And suddenly in the transverse colon, so the very middle of the large intestine, we felt something. So we take it out, we cut it open with a scalpel, and lo and behold, there is a full-sized toothbrush. And we're like, what? How did this happen? And immediately you're thinking, did she swallow it? Did she go the other way with it? Amazing, because it's in the middle of the entire colon. And so after we sewed her up and everything, and we woke her up and we said, did you know that you had a toothbrush in your colon? And she said, I told them at the mental hospital that I swallowed one, but they convinced me that I didn't. She failed to mention that earlier. So, but I will tell you that her teeth were not great, but her colon was minty fresh. Just kidding on that one. She had great teeth, but it was really just an amazing experience that what the human body can tolerate. She swallowed a toothbrush and it made it all through the small intestine, all the way halfway through her colon. And this was like years before. So it had been sitting in there forever. Anyways, this is why rural surgery and rural medicine is great, because again, we get to do all the cool things, whatever walks into our exam rooms. And we also have, we have specialty clinics. So we have cardiologists, orthopedic surgeons that come here, urologists, podiatry, and we have specialists that also come visit, but they're only here once a month. And so if they need a cardiologist, like a heart doctor right away, we're probably not going to wait a month if they're having a heart attack. We ship them out. But if it's just for a routine follow-up from something, then we'll wait and they can see them right here at our hospital. So one thing I want to talk about is just the role of healthcare in the community. Also, is we participate in different fundraising events. Like this was the hospital bed races, where we literally put my dad on the hospital bed and ran him down a blocked off street in our downtown square. competing with other people doing the same thing. And so we dress up when we do that. I don't know if you noticed this theme, but we were Little Bo Peep and his sheep. So very disturbing when that's your father. We also participate in the health fair, and we're one of the biggest employers in the entire county. And so it's a really big, important role that we play in the community. Just being able to be a big part of it, not just taking care of people, but actually being part of all of it. And so what does it mean to be rural? So 19% of the US population lives in rural areas, but there are only about 10% of the physicians that go to rural areas. So you can see that we really need people in rural areas. So we actually take care of more people than what they do in the urban areas, because again, there's less of us and we're kind of the only gig in town. We talk about, again, this is just kind of a way to see that that even though the US population keeps going up, rural populations are not growing quite so much. And again, our doctors are not all going into rural areas. And so you might see in rural areas that our patients are older and they're a little bit sicker and they're a little bit poorer, and they might not be as educated. You might have people that are more people that are uninsured as well. And, they might not have access to resources that they have in urban areas. So while there are less of us, we're taking care of more patients. We're also taking care of sicker patients. And so, this can be an amazing thing, because you can really make a big difference being one doctor in a rural area, because otherwise your patient might not be cared for, And so this is just another way to show that our patients tend to be older and sicker, less insured. They do live a little bit longer, actually, but they might just not be quite as healthy. So what is rural medicine? I think it's super fun and super awesome. Pros and cons again, you're the doctor. So I worked really hard to get here, right? You go through all that school and you kind of want to do everything that you learned. And so in an urban area, you might not be able to do, let's say, stress tests, because all the cardiologists want to do the stress tests, or you might not be able to do colonoscopies because all the gastroenterologists want to do them, and you don't get to do them. So you get to do everything that you worked so hard to learn and practice. And so you can practice to your maximum ability, and really you get to decide what you want to do and what you don't want to do, rather than somebody else telling you. You can make changes pretty easy. So if I think, man, we really should be doing this when somebody walks into the ER with chest pain, like we need to get that EKG right away as soon as they walk in, versus waiting for when the lab people get there and doing those all at once. So we go to the ER director, we go to medical staff, changes can be made the very next day. And versus like in an urban area where you might have a big hospital setting and you have to go through all the hierarchy to change the policies and check with everybody and make sure that it's going to be okay. So we can make changes for our patients and our patient care very easily. You get to know your patients really well, sometimes too well, but my patients, it's kind of a blurry line, because my patients are also my friends and they're also my kids' parents, and they might go to the same church as me. I probably see them in the grocery store all the time. They're more than our patients, and you kind of see all aspects of their lives, but that also helps you to know how to treat them. So I might say to one of my patients, hey, I know you're a teacher and you're really stressed right now, and I've seen what you've been doing with your kids in school, and it's really great, but I understand where you're coming from in wanting to talk about your mental health. So it's a great thing to know your patients even beyond the exam room. And odds are better for loan repayment, quite honestly. So when I moved to Fredonia, they paid back all of my loans, and at that time it was $200,000. These days, it's even more. And so going to a rural area, you might get, hopefully get the hospital to pay at least part of it back. Or if you participate in different loans, that's another opportunity if you commit to a rural area. So that's a lot of money that basically like you don't have to pay back. And that's pretty cool. And then you are the livelihood of the hospital and maybe even the town, meaning that if I leave, I'm 20% of the doctors that are here in town, and that puts a big strain on the rest of the medical community. So never underestimate your impact on the rural community. It sounds weird, but like when I first started here, everyone made such a big deal about me being here and moving here, and it kind of freaked me out. But you then start to realize that that you are such an important part of the town, and the healthcare, and the healthcare is such a important part of the town. Businesses don't want to move to a town where there's not a hospital or there aren't doctors, because what if their employees get sick? Those are important things that really tie in together. So cons to rural medicine: you may be a little farther from Walmart. So I got to drive 30 miles in either direction to Chanute or Independence to get to a Walmart, but that's okay. You have to behave. So I can't like belly up to the bar every night and then expect people to listen to me when I tell them to stop drinking alcohol. Or I can't, go out and eat a cheeseburger every single night and then tell somebody that they need to have a better diet. So you really have to watch what you do, because people see that also. Grocery store trips take a little longer, meaning that, every time I go to the grocery store, somebody's asking me for a refill on their medication or having me look at a rash or something like that. So you just have to be ready that you're not anonymous in a small town. You might be the only doctor. There have been times where I'm the only doctor within a 10-mile radius, or the only doctor that works at our hospital, and I'm in the ER, and everybody else is left town because they're on vacation, and I have to figure out how to put a shoulder back in place, or how to repair a chainsaw accident, which are real examples. And then pro or con: you might get paid in food and live animals, which I think is really kind of cool. This is real life. This is what we have in our town. It's called Alky's Bar and Grill, and we have an Alky hauler. This goes along with my story of behaving, that you should always behave and not belly up to the bar at Alky's. But if you do, take the Alky hauler home. See, it's hard to make up these stories. This is real life. So this is a story about Peaches. So my dad, when I was a kid, he had done a surgery for somebody, but they were unable to pay. And so they said, I raise goats. Can I give you a goat? And my dad said, sure, why not? So he brought the goat home, and I loved it. I named him Peaches. He was my pet. I went out and fed him every day. And then one day Peaches was gone. And I was like, Dad, where did Peaches go? And he said, the butcher. And I was like, oh, cool. Okay. And then I go, Mom, what's a butcher? And then that's when the tears started flowing. And that's what therapy sessions are built on later on in life as an adult. Anyways, but it was a really nice gesture from my patient, or from my dad's patient to him. And these days we get pies, we get, blankets and things like that people have made just to show appreciation. And that's not why we do it, but it's so meaningful when they put their heart into showing appreciation. So some of the other roles that I hold in rural medicine: I'm the Wilson County Health Officer, and good golly, I never thought that it would be as big of a deal as it is today. During this pandemic, it's been more than I ever expected, having to tell people to wear masks and tell people that they can't have a mass gathering. I haven't made friends, but I know that I'm doing things for the right reason, trying to keep people safe. And so you can find yourself in situations that you never thought you would be in. But every Monday, I lead a discussion in the entire county of schools, hospitals, clinics, businesses, faith organizations, and give them an update on the pandemic and what I think that they should be doing. And again, it's not something that I know about, but I had to learn about very quickly. And you just do what you have to do. Prior to this, I was, working on vaccine protocols and telling people not to smoke. And once I even inspected a lagoon. So that was kind of cool, but not the most fun. But now it has its own role. I actually have a health officer badge as well, but that's with my city health officer job, which I don't do as much, but but it kind of overlaps anyways. But so sometimes I like to flash my badge and try to citizens arrest people, but it doesn't actually work. So don't try it. The cops frown on that. But why not? Why not have a badge? I'm a medical director, the medical director for our local home health and hospice agency. And so that is something that, again, I learned along the way. But again, you as a doctor in a town, you just learn and you go where you're needed. And they needed somebody to help people at their end of life. And that's one of the roles I took on. I am also a high school football team doctor, or really basketball or anything. If someone gets hurt, they call me whether I'm at home or at the game because I live close by, and we just, you know, sometimes we check them out on the field, and sometimes we check them out in the locker rooms afterwards. So I realized very early on that there are two types of high school boys. When you walk into a locker room at the end of a game, there's the ones that are like, oh my gosh, there's a girl in the locker room when I walk by. And then there's the other ones that, you know, they're like, oh, there's a girl in the locker room, and they drop their towel or something accidentally. And, you know, I'm like, nothing impressive there, kids, put your towel back on. So anyways, it's very interesting. You learn a lot about teenagers. Produce aisle clinician, like I mentioned, when you go to the grocery store, people are always going to ask you questions. I also have a lot of community involvement. And so I started the group Cultivate Fredonia. I started the Fredonia Area Community Foundation. And those are all just things that, that I saw were missing. And the amazing part about being a doctor in a small town is people think you know what you're talking about. So when I said, hey, we really need the ability for people to leave money to our community and make meaningful change, then I was able to get people on board to create a foundation. When I said that we need a group that brings people together to start doing projects in town for beautification and for healthy living, then I was able to gather people to create Cultivate Fredonia. And then I actually joined the school board as well when I saw that there was a need there for for people who are maybe like more focused on academics than sports, which was kind of the problem at the time. It's much better now, but so I was the school board president for 2 years, and now I'm just on the school board, so which is also kind of nice. When you also decide that you are your town needs more fundraisers and more fun, through Cultivate Fredonia, I also created Sausage Fest, and you think, that sounds like a really terrible idea. But again, they kind of trust you to have good ideas. And in the end, it's not as bad as it sounds. We have wiener dog races. We have hot dog eating contests. We have the Chorizo Challenge arm wrestling tournament. We have the Mr. Hot Link pageant. But it's actually really fun. We block off the entire town square, and we have a big festival that raises money for things like beautification and healthy living, ironically, and housing and things like that. So again, you come up with ideas, see if you can get people to buy in, and great things can happen, and they can be fun at the same time. And then I do a lot of advocacy, speaking at national conferences and at the Capitol about things that are important, like patients' access to care, and making sure that patients are covered by insurance and things like that, making sure that people are not discriminated against, and helping to push policy that makes the care that we give to patients even better. And I think that's an important part, because if we don't do that as family docs, as rural people, then somebody else is doing it, and they might be sending a different message. And then one time, Bob Dole, if you know who that is, he ran for president a while back, but he also was the senator forever and an American hero. He came to Fredonia and visited once, and I said, hey, I'm a local family doc, and he'd kind of just been superficially, kind of shaking people's hands, and he stopped and looked me in the eye and said, wow, you are one of the real heroes of rural communities. And I just thought, oh my gosh, just in saying that I was a family doctor in town, this amazing man called me a hero. So I just thought that was kind of cool. And then, just as a summary, rural medicine days are filled with variety and are never boring. You just never know what's going to happen that day. You're the doctor, so you really get to practice to your full ability, everything that you learned, and do all the things that you dreamt of, and become the doctor you want to be, because you get to determine that yourself. And then you get to know your patients really well, which is very meaningful for me. So not only do I get to help them feel healthier, but I get to see the results of that, that they're out and about more, playing with their kids, or they are getting to meet their grandkids when they might not have before. Odds are better for loan repayment. You can make really good money in rural areas and also get loans paid back. And so never forget that. It's a very good living, and you're never going to not have a job. And you are the livelihood of the hospital and maybe even the town. So just remembering that what you do is very, very important, and not in an overly confident way, but in a way that that each day that you go to work, it's meaningful for somebody and hopefully for yourself. And you can serve multiple roles in the community. You don't have to, but you can, and really make a difference in the community as a whole. And it's just plain fun. We have a really good time here. All right, and spread the rural love. And I just always put in here that if you're interested in doing a rotation or visiting or talking more, this is my contact information. We have things like donkey basketball, and that's one of my students that I had here before, and that's when I was a donkey basketball participant. Again, this is what we do. This is why it's fun. So thank you so much for listening today, and please don't hesitate to reach out if you ever have any questions. I love what I do every day in rural Kansas, and I hope that at least some of what I said today might be interesting to you as well. And I wish you all luck in the future. Please take care and just be the best that you can always be. Thank you.